this is not just a normal Tuesday. This is recognition day for the General Assembly. This is ownership day for the General Assembly. You know, I'm sorry that you're having to convene this meeting today because I'm sorry the state employees, the active and retired employees, have not been entitled to the prices that they deserve over the last few decades. I'm standing here as the State Treasurer of North Carolina, but we have a great staff that's working on the state health plan, and they understand who their customer is. The customer is the state employees and the retirees of the state health plan. Their loyalty and their duty of care is to those individuals. I was called last week by a senator who got visited by 5 different hospitals. And the person called me because it actually dawned on them after the 5th visit that A, they were all saying the same thing. But more importantly, he dawned on this particular legislator that this is y'all's problem. I just have the responsibility for trying to fix it, and that's what we're intending to do. I see a lot of people in the audience, Mr. Chairman, but there are a lot of people who are not here. Number one is the State Health Plan Board, which is appointed by members of the Senate, members of the House, appointees from the Treasurer, and also the Governor's Office. That board passed overwhelmingly, unanimously, a resolution to support reference-based pricing. The other folks who may not be here are people who are no longer with us. One is Jim Valvano, and those of you who have taken the walk with me at the Oakwood Cemetery and have been by his headstone, on that headstone he says every day you're supposed to laugh a little, cry a little, and think a little. I think you'll probably be doing that over the next 1 hour. But I'm also reminded of what Coach K once said when they asked him about his courtside manner. He said, you know, there's some things that happen right in front of your eyes that are worth getting upset about. When you hear about the condition of the state health plan and what's been going on for decades, I think you'll be upset also. So at the end of the day, there are other people who aren't here, Mr. Chairman. Beth Wood, the state auditor, Les Merritt, the previous state auditor, who 7 and 10 years ago, respectively, had the finding of the state health plan. Even though the state health plan spends over $3 billion a year, the state auditors do not have access to vendor contracts and cannot independently verify that the state is receiving the proper contractual discounts. Doesn't matter what chamber you're from or what party you're a member of, I don't think anybody in this room wants the state treasurer paying bills when we don't know what the bills are for. Secondly is the Attorney General, who has been looking at this issue about steerage and anti-competitive practices over the last few years. Another person who's not here is Anna Matthews, who writes for the Wall Street Journal, who just did a report talking about the fact that what's going on with referrals of the state doctor practices is driving up the cost of health care. Another individual who's not here is former Treasurer Harlan Bowles, who issued this very report 39 years ago. And the finding of this report is the growth in the number of public sector employees and retirees and the runaway medical costs. This is 39 years ago. And the actuarial funding and retiree medical benefits will soon result in public sector obligations that will equal, exceed, and then dwarf the state debt. 39 years later, I'm here to report that the unfunded liabilities of North Carolina with the pension and the health care are nearly 9 times the state debt of North Carolina. On the health care side, that puts us at $30 billion. If you're interested in where $30 billion places you in the United States, according to Pew Research, it places you right behind the state of Illinois in terms of the severity of this problem. Now, no one wakes up thinking about unfunded liabilities and life expectancies and all these other issues. They wake up thinking about how we're going to best educate our kids, protect our citizens from crime, pave our roads, and all the other core functions of state government. But I can certify to you that unless we are able to take advantage of our largeness and give the state employees and the legislature the prices that it deserves in health care across the state, that money is going to be taken away for the next 20 years from things that you care about. Because every dollar that's spent on health care unnecessarily is a dollar that can never be spent on education, public safety, or public roads. The other people who aren't here are the joint committees of this House who have done reports over this over the years. Another person who's not here before the committee is Bill Gates. Bill Gates said 8 years ago that the biggest concern nationwide, now think about this, the biggest concern nationwide are the growing cost of state-funded health care programs and public workers' health care coverages, as well as the way the states account for their pension liabilities. These obligations threaten the ability to invest in public education going forward. Another person who's not here is Corey Freeman. Corey is the editor in the Wilson Times. Corey made a remark several months ago that, let's get this straight, the state treasurer cannot find out from the state hospital what the state health plan is supposed to pay for state health care. If that bizarre sentence gives you a headache, we hope that it will subside before you're in need of any medical attention. Lord knows what a neurologist is going to charge you to diagnose this. Other reports of people who are not here are Rand Coble, who wrote me a thank you note 11 years ago regarding an effort that I overtook in this very House 11 years ago to try to resolve the unfunded health care and pension liabilities in North Carolina. Representative Folwell was a leader in saying that the legislature ought to deal with this shortfall before the legislature adjourns. In that particular year, I filed a bill to put $100 toward this $30 billion shortfall. $100. That bill did not get passed. And the reason is that once you put $100 toward a problem, then all of a sudden you've got to recognize what the problem is. And that's what we are attempting to do. Anna Matthews, I mentioned earlier, secret hospital deals drive up the rising cost of health care. Her and her fellow writer, Melanie Evans, is not here. Hospitals push doctors to keep referrals in-house. There's examples here of where when an independent doctor is bought up by a big hospital, that the pressure to make referrals inside the system is growing so dramatically that it drives up the cost of health care. Articles from Triangle Business Journal about why health care costs so much in North Carolina by Ed Martin and Dave Middleburg, digging out of a $34 billion hole in Triangle Business Journal. Over the last few months, there's been a report not sent by the North Carolina Treasurer, but the United States Treasurer, the United States Labor Secretary, and the United States DHHS Secretary, talking about the need to have transparency, accountability, so that we could lower costs of health care for the whole country. In the Kelly Goose just wrote an article, hospitals, not physicians, are driving up health care costs. And they are the driver of health care spending growth, not only for public but also private use. And then 8 years ago, there was a Pulitzer-nominated award-winning series that the News Observer wrote about the problem with rising health care costs in North Carolina. So before I take up any of your time talking about the people who aren't here, let me make sure that I remind you who we're here to represent. These are shoes. These are shoes that could represent the average state employee of North Carolina. The people who are out there who couldn't be here today because they're out there educating your kids, protecting you from crime, paving your roads, and all the other core functions of state government. These people are not invisible to me, and they're not invisible to the state health plan staff. It's a very serious issue. So as I go through and summarize that this is not a normal Tuesday, it's because it's ownership day. This legislator who called me realized, as I said earlier, that this is not the state treasurer's problem. This is actually the legislature's problem, who has the responsibility for funding it. So as we go forward, let's talk about how we got here. How we got here is that for almost 40 years, there was no funding for retiree health care in North Carolina. That is the reason that Pew Research puts this problem in North Carolina right behind the state of Illinois, as well as Standard & Poor's. So last summer, or last spring, we tried to figure out what we're supposed to pay for health care. We're spending over $3 billion a year of your money for health care and pharmaceutical benefits. But we're trying to figure out what we're supposed to pay. So I sent a request in to UNC Healthcare. And I said, I know that we're paying you almost $300 billion per year, but can you give me a price list of what we're supposed to pay on behalf of the people that wear these shoes in criminal justice, in public safety, in public education, and all the other core functions of state government? I know how smart you all are, so I'm going to show you what the price of an appendectomy, a tonsillectomy, and a knee replacement cost at UNC Healthcare. This is what was sent to us. 140 pages, every one of them was completely redacted. So we convened a meeting last summer with the stakeholders, including the speaker that's getting ready to come in front of you, Blue Cross Blue Shield, legislative staff, attorneys, primary care physicians, hospital associations, medical society, mental health, behavioral health specialists, all kinds of folks. And we asked them one rhetorical question. How much waste, fraud, and abuse do you think there is in the health system? The person from one of the societies said 12 to 15%. From Blue Cross, the person said 15 to 25%. I said, great, we're done. Go forth and bring us all the examples that we need on how we can cut this waste and fraud and abuse out of the state health plan. And I promise you, within 6 months, these hardworking people at the state health plan will operationalize that. All we got is crickets. So as we set forth, and nobody will tell us what we're supposed to pay, in addition to that, we had no concrete examples of how we can really cut these expenses. We set about on reference-based pricing. Now, you're going to hear a lot over the next few minutes about reference-based pricing and value-based. Let me tell you that you cannot have value-based healthcare unless you have something to refer it to. You cannot cut the cost of anything in this world unless you know what it costs to start with. It's basic, simple, common sense. So as we move forward, we went to reference-based pricing. Let me remind you, when everybody talks about how awful reference-based pricing is, Medicare, reference-based pricing. Medicaid, reference-based pricing. The workers' comp system for health care, reference-based pricing. The health care that we provide to prisoners is reference-based pricing. As a matter of fact, in those last two examples, we're giving Medicare plus 40% profit for people who are workers' comp victims and injured on the job and need health care. And prisoners who need health care, they're compensated by agreement with the very people who are getting ready to come up and speak to you, also at a 40% profit. What we're offering in this plan is on average is 77% profit. Some will make a lot more than that, especially primary care physicians, behavioral health specialists. The main job of a primary care physician and a behavioral health specialist in this state is to keep people's tails out of hospitals. That's the main goal of a primary care physician and a behavioral health specialist. And those people will be getting pay increases generally over this plan. How much time do I have?
You have 5 minutes.
Okay, thank you. So as we go forward, the reference-based pricing is something that's going to be really great for North Carolina. I see a few cups of coffees and I see a few Coca-Colas out there. Some of you may have bought a tank of gas over the last day or so. There's nothing in your life, whether it was dinner last night, whether it was a cup of coffee or a tank of gasoline, there's nothing in your life that you have consumed where the customer and the payer weren't right close together. In healthcare, what has happened over the last 40 years is the customer's over here and the payer's over here. The customer never really knows what the payer paid. And the payer really never knows what happened to the customer. Our goal here is to bring transparency, lower costs, push the power out to the state employees and retirees so that they can consume health care just like they consume everything else in this state. One that I didn't read to you, Mr. Chairman, is one from a teacher. A teacher who was ordered in Thanksgiving to get an echocardiogram in the eastern part of North Carolina. So let's personalize this just for a moment. This teacher was ordered to get an echocardiogram, and they were sent to an imaging center to do the echocardiogram that was also owned by the referring doctor. This goes back to the Wall Street Journal article. This person walked up and said, I got ordered this procedure, and the intake lady says, happened to be a lady, could have been a man, said, I need $1,200. And he said, $1,200? I don't have $1,200. And she said, well, we need $1,200 for this. And he said, I don't have that. She said, well, we can put you on payments. He said, I can't afford the payments. So this teacher in Cumberland County asked the question, how much is this really going to cost, all total? And the person told her, we'd never be able to tell you that. The fact is that no one's ever able to tell anybody what any of this stuff costs in healthcare. This teacher took that negative experience and 5 days later got an echocardiogram 28 miles from their house for $210 total, cash. This is what happens when you're able to be transparent. You can lower the cost of health care and push the power down to the state employees so they can do this. As I close, I want to tell you what's going on around the country. This really started with me several years ago when I was doing workers' comp reform. When I talked to the person at Food Line in Salisbury, and Food Line was sending people to Singapore to get their knees replaced. And then somebody in Arizona found out they were sending people to Singapore to get knee replacements, and they said, we can do this that cheaply in Arizona. And then somebody in North Carolina or South Carolina found out they were sending people to Arizona, and then they said, we can do that at the same charge. The fact is that when you give people the information to consume, they can be terrific consumers. I'll tell you that this is not just healthcare, but it's pharmaceutical. It's either Utah or Nevada who's now giving travel vouchers to state employees to go to Tijuana to purchase their prescription drugs, and it's going to save the state money. These are the things that are going on. As I close, Mr. Chair, I want to mention a few things. There's been a lot of talk about plucking the feathers off the state health plan in the Treasurer's office. I know these individuals who represent the state health plan. And I will tell you something that may just irritate you a little bit. They take it personally. You know why? Because they're keepers of the public purse too. They deal with 720,000 participants in these plans. Let me tell you how complex the state health plan is. Last year, we had 165,000 life-changing events, equal to what the size of Winston-Salem used to be. Just life-changing events in the state health plan. So as I close, Mr. Chair, I just want to remind you of a couple of things. The many people who aren't here who wear these shoes, they're not here because they're too damn busy educating kids, protecting you from criminals, paving your roads, and all the other core functions. I'll also remind you of something that George Clooney said in the movie Monuments Men. When there's a little downside and one of the Monuments Men got killed, he said, let me tell you something. One day there'll be hundreds, thousands, maybe even millions of art lovers from around the world who are going to go and view the things that we're preserving, and no one's ever going to know who did it. When you partner with the State Treasurer's Office and help us save the state health plan, no one's ever going to remember that you did it. Thank you.